antenatal glucocorticoids for labor-preterm birth. Definition: labor-preterm birth is defined as the labor between 34 weeks, 0 days, through 36 weeks, 6 days of gestation and accounts for 70% of all preterm births.
Doctors have prescribed steroids to pregnant women at risk of preterm delivery for decades. What about those at risk of late preterm delivery? Should we call in with your latest health news? In preterm delivery or delivery before the 34th week of pregnancy, one common fear is that these lungs won't be sufficiently developed, which can be lethal. Doctors often prescribe corticosteroids to women at risk of preterm delivery because these drugs accelerate unborn baby's lung development. But women at risk of late preterm delivery or delivery between 34 and 36 weeks, steroid prescriptions are much less common, likely because babies delivered at this stage have much higher survival rates than babies delivered earlier, according to a press release from Columbia University Medical Center. Still, late preterm babies have increased rates of respiratory problems compared to babies born at term or 37 weeks or later, according to this study. That's where a steroid prescription for pregnant women at risk of late preterm delivery could step in. Lead study author said in a press release, quote, "Our study demonstrates that administering medication that is commonly used to prevent complications in babies born before 34 weeks of gestation can also reduce the risk of many serious complications in babies delivered just a few weeks before term. Speak to your doctor about the risks and benefits of steroid prescriptions."
Late-preterm infants make up the largest proportion of preterm births and are at higher risk for neonatal death and complications, including respiratory disease, and are infants born at term at least 37 weeks of gestation. Late-preterm survivors are also at risk for lifelong health problems, including cerebral palsy and learning difficulties. Applications in medicine. Personal and social causes of these births are substantial. A single course of an antenatal glucocorticoids given to mother at risk for preterm birth is now the standard prophylactic treatment against respiratory distress syndrome.
Premature birth is the second greatest killer of babies worldwide after pneumonia. A report called "Born Too Soon" says 1 in 10 babies throughout the world is born before the 37th week of pregnancy. As a midwife, Carol Priestern assists women who are giving birth. She also has seen newborns die.
It's a devastating experience. It touches you around people's faces.
Carol Priestern works with the Partnership for Maternal, Newborn, and Child Health. She says much can be done to prevent premature births.
You make sure people are not having their babies too young. Make sure if they have pre-existing conditions like they're too underweight, which is quite common in the developing world, as you know. You've got to also look at if somebody's had a history of preterm birth, they need much more attention. You want to look at the spacing between births, so you don't want people having their children too fast, because that can lead to prematurity.
There are simple things that can help a premature baby survive.
You can give the mother steroids before the baby is born. That helps the lungs mature. That's a very cheap, very cost-effective intervention.
After birth, the baby can be placed on the chest of the mother. This kangaroo care method keeps the baby warm. Dr. Joe Long works for Save the Children.
Kangaroo mother care, even compared to carrying an incubator, halves the risk of death. comparison is with the March Times.
Over 60% of preterm births occur in sub-Saharan Africa and South Asia.
Wherever a baby is born, the child can have health problems if the birth happens even a few weeks early. Experts say they want to better understand why babies are born early, how to reduce the number of premature births, and how to help premature babies survive. I'm Shirley Griffith.
My work is basic developmental research, but it also has applied arm, and that applied arm is primarily focused on trying to develop an animal model that helps us better understand preterm human infant growth and development. Those weeks or months that they're spending in the neonatal intensive care unit, they're getting very, very different patterns of sensory experience. And when norming happens, say, in utero during that full gestation, we're really looking at how does prenatal experience spill over and affect postnatal development. We ended up working with bobwhite quail for probably about a half a dozen reasons. They come in an egg like all birds do, and that makes access to observing prenatal development.
Antenatal glucocorticoids. Corticosteroids stimulation of the developmentally regulate gene expression and psychologic functions result in maturation of the lungs and some other tissues. Antenatal steroids accelerate development of type 1 and type 2 pneumocytes, leading to structural and biochemical changes that improve both lungs mechanics, maximal lung volume compliance, and gas exchange. Induction of type 2 pneumocytes, increasing surfactant production by inducing production of surfactant proteins and enzymes necessary for phospholipid synthesis. Other effects of antenatal glucocorticoids include induction of pulmonary beta receptors, which play a role in surfactant release and absorption of alveolar fluid when simulated, induction of beta-lung antioxidant enzymes, and upregulation of gene expression for the epithelial Na+ channel, which is important of exertion of lung fluid under birth. For these changes to occur, however, the lungs need to have reached a stage of development that is biologically responsive to corticosteroids. Pros and cons. Several respiratory complications, transient tachypnea of the newborn, surfactant use, and bronchopulmonary dysplasia also occurred significantly less frequently in the betamethasone group. There were no significant between-group difference in the incidence of coronary tonsils or neonatal sepsis. Neonatal hypoglycemia was more common in the betamethasone group than in the placebo group. Most pregnant women tolerate a single course of antenatal corticoids without difficulty. In conclusion, administration of betamethasone to women at risk for late-preterm deliveries significantly reduce the rate of neonatal respiratory complications. Thank you.